Hi everybody, my name is Paul Gerard. I'm a student loan consultant and I'm very pleased to be working with the American Dental Education Association, ADEA, to provide you with some information designed to help you do a better job of managing your student loans. This module is designed specifically for the incoming class of 2020, and we hope that it will help you not only borrow more responsibly while you're in dental school, but help prepare you for repayment after you graduate. In this short module, we're going to take a look at some cost considerations of dental school, and we'll certainly talk about smart budgeting and how it can lead not only to responsible borrowing in dental school, but once again, help prepare you for repayment after you graduate. We'll take a look at dental school debt nationally, and we'll talk about what kind of loans you will likely be borrowing as a dental student. We are going to take a quick look at repayment strategies. What are your colleagues who've already graduated? What are they doing in terms of repayment of their student loans under the guise of learn from your colleagues? And then we'll close this up with some action items, some things you should be doing to prepare you to borrow responsibly and repay responsibly, and some resources to help you do just that. Now, under cost considerations, your financial aid office can provide you with what's called a cost of attendance or student financial aid budget. Now, you have one for every year of dental school, and we would encourage you in that budget to look at the items that comprise the monthly living allowance, and this would be room and board, personal and transportation expenses. We'd encourage you to find out what that number is, divide it by the number of months in your first year budget, and that will give you the monthly living budget for your first year of dental school. We'd encourage you to focus on that and control in your budget, in your cost of attendance, what you have some control over. Don't worry about tuition and fees. Those are set. Nothing you can do about those. Focus on your room and board expenses, personal and transportation expenses, and never borrow more than you need. You're going to find out, if you don't already know, that in a combination of direct unsubsidized and direct plus loans, you can borrow up to the full cost of attendance at your dental school minus any other aid you might be receiving. But just because you can do that doesn't mean you have to. So never borrow more than you need, and don't assume you need the full cost of attendance. Be cautious about private loans if you're considering a private loan, either in lieu of federal loans or in addition to federal loans. We'd encourage you to always talk with your financial aid officer before you take out a private loan. Now, we could also title this slide, What You Do Now Matters. We want to look at a few things that can happen in dental school and the impact after you graduate. Poor budgeting while you're in school, and with no disrespect intended, using credit cards to live beyond your means, perhaps with a sense of entitlement. Folks, that can mean that you're going to be forced into a repayment plan, or you may be forced into a repayment plan that you really don't want after you graduate, perhaps an extended plan when you'd really rather be more aggressive, but you simply can't afford to be because you're paying down consumer debt. So poor budgeting decisions can certainly impact the repayment plan you end up in after you graduate. If you borrow under your budget, under the financial aid budget, your cost of attendance number, you can always borrow more later up to the cost of attendance, and this also helps delay interest accrual because interest begins to accrue or build up as soon as a loan is dispersed. So if you can hold off on some of your borrowing, that should help you in terms of the total amount you owe in repayment because you're delaying the start of interest accrual on a portion of your loans. And finally, not tracking your loans each year. There are a number of resources we're going to look at that will help you track your loans. And if you just don't pay attention to this from year to year, you can have sticker shock at your senior loan exit interview before you graduate. You want to go into your fourth year, and especially the senior loan exit interview in the spring, knowing exactly what you've borrowed, exactly what kind of repayment strategy you're thinking about, or a pretty good idea about what your repayment strategy is going to be. And that will certainly help you as you graduate and move into repayment. So smart budgeting now will lead to responsible borrowing later. As we move into a discussion of the dental school debt and what you can be borrowing as a dental school student, take a look at the average numbers for indebted dental school graduates. These are from the class of 2015. We're recording this in July of 2016. We don't have the class of 2016 numbers yet. The average is just over $250,000. Again, this is just for indebted students only. You do see some good news that just over 20% had no debt or debt under $100,000, but you also see a substantial percentage of borrowers who had debt in excess of $300,000. So those are the national dental school debt figures. Now, in terms of your student loan portfolio, what you may be borrowing, there are a number of different kinds of loans you may have in your student loan portfolio when you graduate from dental school. The direct unsubsidized and direct plus loans, we have those highlighted, and we're going to look at those in more detail on the next two slides. These tend to make up the bulk of, if not all of, the student loan portfolio for many dental school graduates. If you've not already done this, check with your school's financial aid office about the availability of what are called campus-based loans. These include health profession student loans, loans for disadvantaged students, and in some cases, institutional loans that come directly from the school. Some of you may also have private loans in your portfolio, either from college and/or a post-bac program, or you may be considering taking out a private loan in lieu of a federal loan or in addition to a federal loan while you're in dental school. Once again, we strongly encourage you to talk with your financial aid office before you do that because of the differences between federal and private loans. Now let's take a quick look in detail at the two loans that we think many of you will be borrowing for dental school. First of all, the direct unsubsidized loan. Some folks still refer to this as Federal Stafford. $40,500 a year. Some schools will prorate that amount up slightly based on the length of your financial aid budget each year. These loans have a fixed interest rate. The new rate for loans dispersed on or after July 1 of 2016 is 5.31% fixed rate. These loans have a 6-month grace period. In other words, they come due about 6 months after you graduate. For you, that would be roughly November or December of 2020. Multiple repayment provisions and repayment options available. And these loans are eligible for forgiveness, including the Public Service Loan Forgiveness Program, if you meet the eligibility requirements for PSLF. Now, the second loan you may be taking out, depending on the cost of attendance at your school and if you get any other aid, over and above the direct unsubsidized loan, is a direct plus loan, also sometimes referred to as grad plus. There is no annual limit. We've referenced this before, but you can use direct plus and borrow it up to the total cost of attendance minus other aid, including the direct unsubsidized loan. But a reminder, just because you can do that doesn't mean you have to. A fixed interest rate, and notice that the current rate is a full point higher than the rate on the direct unsubsidized loan. The rate this year on a direct plus dispersed on or after July 1, 2016 is 6.31% fixed rate. These loans don't have grace periods, but they have something that operates in a very similar manner called a 6-month post-enrollment deferment, meaning these loans should be coming due about 6 months after you graduate. And just like direct unsubsidized, multiple repayment provisions and repayment plans available on these loans. And these loans are eligible for forgiveness, including the Public Service Loan Forgiveness Program. Now, we've talked briefly about budgeting and how things that you do now in dental school can impact repayment later on, and we've taken a look at the national debt figures and the direct unsubsidized and direct plus loan that many of you will be using to finance dental school. Let's take a look at some repayment strategies. How are your colleagues who are already out of dental school, how in the world are they paying their student loans back? This is a list of some repayment strategies that some of them are using. Some of your colleagues will aggressively repay their student loans. They find a repayment plan they can comfortably afford, and then they work with their loan servicer to target extra payments on their most expensive loan to pay the debt down as quickly as they can. Others of your colleagues who have graduated and are in repayment are making the minimum payment possible because they have cash flow challenges, perhaps consumer debt that we talked about, private loans, other obligations that need more attention than their student loans, or they may be making minimal payments because they're trying to maximize the forgiveness amount under the Public Service Loan Forgiveness Program. More than a few of the dental school graduates who have a large gap between their federal debt and their income will use income-driven repayment plans, plans that are tied to income, such as income-based repayment known as IBR, pay-as-you-earn known as pay, and revised pay-as-you-earn known as repay. They're using these plans to get them a manageable payment, and then, as we referenced in the first two bullets, they're then deciding, do I pay over and above that amount, or do I just pay the minimal amount because of other obligations I have? Some dental school graduates look for help with loan repayment that is tied to a service commitment. In exchange for service to the Armed Forces, the Indian Health Service, NIH, the National Health Service Corps, the borrowers get loan repayment help sent to them that they can use to help pay down their student loans in exchange for service. These are not forgiveness programs. These are simply service commitment programs where the borrowers receive money in exchange for service commitment to help pay down their student loans. So lots of repayment strategies in effect with dental school graduates. Now, as we close this module up, some action items for you. Certainly stay in touch with your financial aid office during your time in dental school. Very important that you don't miss deadlines, and they can help keep you abreast of any changes that may come up that may impact your borrowing and repayment. As we mentioned, get a realistic budget. Focus on those things in your budget you have some control over and stick to it, and try to stay under the cost of attendance living allowance number if you can. You can always borrow more later if you need to. Be sure you know who is servicing your student loans and set up an online account with them to help track your student loans each year. And go ahead and start thinking about your repayment strategy. Review it every single year so that when you get to your senior loan exit interview, you've got a pretty good idea about how you want to go about repaying your student loans. We'd encourage you to use the AAMC ADIA Dental Loan Organizer and Calculator. You can find that at adia.org/DLOC for Dental Loan Organizer and Calculator. This is a terrific tool to help you track your loans and manage your payments, and just to get a really good idea about what repayment is going to look like for you after you graduate, even if you happen to do a residency program. You can retrieve your loan information from the National Student Loan Data System at nslds.ed.gov. And when you use the calculator, we'd encourage you to put in projected borrowing numbers. That way you get a really realistic look at what your total repayment is going to be like when you enter repayment after graduation. So lots of action items for you, plenty of time to take care of this, but we'd encourage you to put some time and attention into these. And in terms of resources, we just mentioned the National Student Loan Data System. This is the federal database of all your direct unsubsidized and direct plus loans. We've already mentioned DLOC, the Dental Loan Organizer and Calculator. Once again, your loan servicer's website, and a very good site, Federal Student Aid at studentloans.gov. Look under the Managing Repayment tab for lots of information. We hope the information in this short module will help you do a better job of responsible borrowing as you prepare to responsibly repay your loans after you graduate from dental school, and we wish you nothing but the best in dental school and your dental school careers.